Director Lisa Nielsen, and President Becky Matthews. Good afternoon.
Hi. Good afternoon. Hi, Bart. Nice to see you.
Yeah, nice to see you both. You guys actually moved closer to downtown not too long ago, so you're neighbors.
Correct.
Yes.
Easy to get here.
Yes.
Did you walk?
No, I didn't. Due to the wind, I did not walk.
I don't blame you. They're in the Commonwealth Commerce Center, and so yeah, on a day like today, it's a hike.
Yeah. Well, it's slushy and slippery.
Mhm.
Yeah.
Now you started, and you've been with the organization back when it was known as something else.
I did. I started with the organization about 21 years ago when it was Great Lakes Home Health and Hospice.
Mm-hmm.
I worked in hospice for 21 years. So when I retired 3 years ago, I joined the foundation. Maybe, yeah, it was close to 3 years ago I joined the foundation because hospice is really close to my heart. So.
Nice. So this is a foundation and a nonprofit that has the affiliation with Elara Caring,
Yes.
right? So how does this hospice work? Is it where you go to people's homes to provide the service?
So hospice is, it's paid through insurance, so it's a benefit through Medicare, Medicaid, and private insurances. And our nurses go to homes and nursing homes, facilities, wherever the patient calls home. We just don't have a building that they come to. And then hospice covers the basic services that the patient needs and the family needs: social work, chaplain, nurse, equipment, medications, things like that. And those are all very important and a good benefit to have when you're a terminally ill patient and family. And then our foundation is a supplement to that. So things that the hospice can't cover that might be a need or a want for the patient, we help support that.
Nice. And it does, as an organization, do fundraising because there's some extras, other services, other supplies that you need that you can use to help these patients in hospice.
Yes.
Correct. Sometimes it is a patient need, like an electric bill that needs to be paid. They may be on oxygen 24/7, and that increases their electric needs. Or there may be a last wish or other items.
And this is how people can support the foundation through, well, I guess if they scan this, they'll be taken to a spot where they can contribute?
Yeah.
Correct. Yeah. It goes right to our website. There's a donate link right at the top. And so all donations go to help patients in need and their families and bereaved.
Now you brought an emotional support animal.
I
with you
did.
today.
I told you I'd be a little nervous, so I brought my emotional support friend. But this is to represent Legacy Bears. That's one of the programs that we do offer for our patients so that they can leave a message. It's a voice recordable bear. It has a little voice box in here. It's not very long, but patients can leave messages for their families, for their children, grandchildren, or even their spouse.
Oh, that's a neat touch. Some of the end-of-life care that you provide includes fulfilling special requests. It's like essentially last wishes.
And that's what Lisa and I love the most about the foundation. So the foundation is a separate entity from the hospice. So the money that comes to the foundations through donations is used specifically for patient and family needs and wants. So it's not used to pay our bills or to pay our staff. It's specifically used for the patients.
So can you give us an example or two of some of these things that you've been able to do for patients?
One of the main categories is bringing family members to the bedside. And so we've had a number of family members that we've been able to provide a plane ticket for to come be reunited with their loved one before they pass. So there's a number of situations like that this year. And recently, I guess it was in the fall, one of our patients, Beth, she's a younger patient. She took a trip to, she loved red pandas, always wanted to go see the red panda exhibit at the zoo, and so we were able to provide that for her. She and a friend went to the zoo. We paid for their hotel stay. She is in a situation where she couldn't travel to Toledo and back to Jackson within the same day, and so she needed to break it up, and so we were able to provide that. And I don't often get emails or letters back from patients, but I usually hear it through the teams. But Beth sent this beautiful email explaining exactly why the experience was so exhilarating and meaningful to her, expressed how it was one of the best days of her life and how she was able to truly feel like a human and not like a patient for a day. And it's those types of things that just warm my heart and really, I think, motivate us to continue to want to help others.
Yeah, it's not just the patient. The whole family gets an awful lot of benefit from
Yeah,
something
Definitely.
like that.
It's kind of a ripple effect.
Yeah.
You know,
And when you think about hospice, you think about, elderly patients that have had a long, full life, and
That's
when
right.
it's a child, that's going to be really hard. And
Yeah,
As-
we
as
have a
a-
lot of younger patients as well. A story that I like is a young woman who was at the end of her life, and sometimes it's a hardship for the families when they have a dying patient, because sometimes the spouse will have to quit work, and so the money is not as available, and she wanted to get the American Girl dolls for her 2 children, and the foundation was able to sponsor that for her and get those dolls for her children. Unfortunately, she passed before the girls got the dolls, but I just love the story that we were able to help her and make that wish come true for her.
well, the girls got the dolls, and they were from.
Absolutely.
they did.
Yeah.
And the
And it
father,
was from Mom.
Yeah, and the father was there to experience that, and he said that made a very difficult day a bright, spot of sunshine to see his daughters at least be excited on Christmas for the dolls.
And that's neat that it's able to be done, with this, there's dignity for the family. It's not like they, and I hate to see this, that people have to go on like GoFundMe to raise money to do these kinds of things.
Yeah.
So this provides them with the privacy and the dignity.
That's right.
A lot of hesitation from families to go on hospice, to engage with hospice. What do you tell families? Is it too early? Is there ever a point where, you have the diagnosis that maybe it is too early?
Sometimes it can be too early, and that's based on the insurance. They say that you have to have a 6 months or less diagnosis to be able to be, our prognosis to be on hospice. Sometimes our patients live longer, and that's okay as long as they're still showing that decline. But it's never too early to call. It's never too early to call and ask, is it time? Because hospice provides not only support for the patient, but so much support for the caregiver to help them and show them what to do day to day to care for that patient.
Yeah, even just some time off, a break.
Absolutely.
What about during the holiday season? Are you guys doing anything different or special in terms of what you're providing?
Yes. So we, in addition to those last wishes, we are fundraising for our Branches of Hope, which provides Christmas gifts to children. Like Becky said, there's been an uptick in the number of young patients that we're seeing on hospice, and so therefore we have a lot more grant requests that are coming in for Christmas gifts for children of the hospice patient and sometimes grandchildren as well. So we have a drive that we're sponsoring to be able to provide those gifts for children.
And people can give through this QR code
Yes, correct.
as well?
So that goes directly to a specific landing page that will, all the money raised in that particular campaign goes directly to help.
Yeah, I hate that we have younger patients in
I
hospice.
know.
When you say younger, what do you mean? Like
32, 36, mothers and fathers. So either it can be either, but oftentimes it's the primary breadwinner that is the hospice patient, and then like Becky said earlier, the other person has to quit their job to be able to stay home, and so it puts them in a difficult situation for a few months.
anyone on social media is going to see this. People, they have horrible stories where a family member is suddenly with that diagnosis. What's the best way for someone to support or be there for a family like these younger patients, to whatever we can do to help?
So the donations help because we're able to get back to the patient. But if you're talking about families that are trying to support close friends or something, people that are trying to support, just giving the caregiver maybe some time off, going and sitting with the patient for a few hours so the caregiver can go and take a break, bringing meals to the homes, just anything to help give them a little bit of a relief during this busy time. And you know, none of us are going to get out of here alive. So to me, having hospice there at the end of life and then having the support from the foundation, I mean, it's just priceless. There's just nothing better.
And you're also an RN,
I am.
right?
Yeah.
So you've been a direct care
I
worker.
have been at the bedside, yes.
Yeah.
Yeah. And I loved it.
Are there volunteer opportunities with?
Yes. There's many volunteer opportunities with the hospice, with Elara Hospice, other hospices as well. And there's also volunteer opportunities with the foundation.
Yeah, I was just going to say, I actually started volunteering for Elara Caring Hospice. So I have my day job with the foundation, and then on my off time, I have a route of patients that I see. So definitely when you talk about how can you support someone, volunteering to, if it's a friend that you already know that you can go be with, like Becky said, but also just sign up and be a volunteer to go visit patients. They need friendship, companionship, just like any of us, and contact with the outside world.
And I would suggest the other thing on the other end of the time frame, you know, versus too early, it can be too late as well, can it?
It can.
Yeah.
We do have patients that sign up at the very last moment, and we support them as much as we can, but the longer we can have the patients and family on services, the better it is for them.
Do people have a hard time accepting that with hospice? That
Sometimes.
It's, yeah.
Sometimes the families have a harder time accepting than the patient does, you know. So
It is amazing to see, though, that the quality of life, often the patient will stay alive longer, if I
Yeah.
can say it that way, just because of all the extra services and touch points with people and the extra help that the caregiver can. So really, hospice is a benefit that should be utilized, and you may be surprised with how well your loved one does.
yes,
People come off of hospice as well. I mean,
They
that's
do. They
not
graduate.
probably- yeah.
yeah,
That's true,
yeah, they
Yeah.
graduate.
which is awesome. There's your Christmas miracle. Hopefully we'll have some
Yes,
this
Yeah.
Christmas.
Yeah.
yes,
But yeah, people can live for years
yes,
on hospice. And really, we're pretty lucky because there are many communities, even bigger than ours, that don't have any kind of hospice care. So that's another reason it's great that we live here.
that's right.
So to volunteer, to give, they can all go through the website
Yeah.
and
Yes,
get
Definitely, the contact us, there's a link right there on our main website. If you say contact us and just put what you need, we'll get back to you.
Awesome. Did your emotional support animal help?
It sure did. I'm not sweating as badly. Thank you.
Well, thanks for coming in, and Merry Christmas. And
Thank you, Bar, you too.
Yeah, thanks for sharing the story of Elara Caring and the Elara Hospice Foundation with Becky Matthews and Lisa Nielsen. Well, next on the show, we've